What is amnesia? A person's ability to recall events and experiences involves a variety of complex brain processes. Researchers still do not understand exactly what happens when a person commits something to memory or retrieves information stored in the brain. When a person develops amnesia, they often lose memories of important milestones, key events or people in their life, and vital facts they have learned. Types of amnesia. Several different conditions involve amnesia, and there are many types of amnesia. Some features of different types of amnesia can overlap, and a person can have more than one type. Amnesia can be temporary or long-lasting. The most common types of amnesia are: 1. Anterograde amnesia. A person with anterograde amnesia cannot remember new information. 1. This usually results from brain trauma, such as a blow to the head that causes brain damage. 1. The person will have their full memory from the time before the injury. 2. Retrograde amnesia. In some ways the opposite of anterograde amnesia. Retrograde amnesia is when a person cannot remember events that occurred before their trauma, but they can remember what happened after it. 2. In rare cases, both retrograde and anterograde amnesia can occur together. 3. Transient global amnesia. This is a temporary loss of all memory and, in severe cases, difficulty forming new memories. 3. This is very rare and more likely in older adults with vascular, blood vessel, disease. 4. Traumatic amnesia. This refers to memory loss resulting from a hard blow to the head, for instance, in a car accident. 4. The person may experience a brief loss of consciousness or coma. 4. This type of amnesia is usually temporary, but its duration often depends on the severity of the injury. 4. Amnesia can be an important indicator of concussion. 5. Fugue or dissociative amnesia. Rarely, a person can forget both their past and their identity. 5. They may wake up and suddenly have no sense of who they are. 5. The trigger is usually a traumatic event. 5. The ability to remember commonly returns within minutes, hours, or days, but the memory of the triggering event may never come back completely. 6. Post-hypnotic amnesia. A person cannot recall what occurred while they experienced hypnosis. 7. Source amnesia. A person can remember certain information but not how or where they got it. 8. Alcohol-induced amnesia, also called a blackout. This is when a bout of heavy drinking leaves a person with memory gaps. 9. Prosopamnesia. The person cannot remember faces. 9. People can either acquire trusted source it or be born with it. Causes. Any disease or injury that affects the brain can interfere with memory. Memory function engages many different parts of the brain simultaneously. Damage to brain structures that form the limbic system, such as the hippocampus and thalamus, can lead to amnesia. The limbic system controls a person's emotions and memories. Medical causes. Amnesia may result from brain injury or damage. Possible causes include: 1. Stroke. 2. Illnesses that cause encephalitis, or brain inflammation, which typically include bacterial or viral infection or autoimmune reaction. 3. Oxygen deprivation, which may result from a heart attack, respiratory distress, or carbon monoxide poisoning. 4. Some medications, such as the insomnia drug Ambien. 5. Subarachnoid hemorrhage, or bleeding in the area between the skull and the brain. 6. A brain tumor that affects a part of the brain involved in memory. 7. Some seizure disorders. 8. Head injuries. which can lead to loss of memory that is usually temporary. Amnesia symptoms. The following are common symptoms of different types of amnesia. 1. Impaired ability to learn new information, anterograde amnesia. 2. Impaired ability to remember past events and previously familiar information, retrograde amnesia. 3. Experiencing false memories, which are either completely invented memories or real memories misplaced in time, a phenomenon known trusted source as confabulation trusted source. 4. Impaired short-term memory. 5. Partial or total loss of all memory. 6. Confusion. Diagnosis. A doctor will need to rule out other possible types of memory loss, including those caused by dementia, Alzheimer's disease, depression, or a brain tumor. The doctor will take a detailed medical history, which may be difficult if the person does not remember. Family members or caregivers may need to be present. The doctor will need the person with amnesia's permission to talk about their medical details with somebody else. Questions may include: 1. Can the person remember recent events and events further back in time? 2. When did the memory problems start? 3. How did they develop? 4. Could any factors have caused the memory loss, such as a head injury, surgery, or stroke? 5. Is there a family history of any neurological or psychiatric conditions? 6. Does the person consume alcohol? 7. Are they taking any medication? 8. Have they taken illegal drugs, such as cocaine or heroin? 9. Are the symptoms undermining their ability to look after themselves? 10. Do they have a history of depression or seizures? 11. Have they ever had cancer? Treatment. In many cases, amnesia resolves without treatment. However, if an underlying physical or mental disorder is present, treatment for that condition may be necessary. Psychotherapy or cognitive behavioral therapy, CBT, may help some people with amnesia. Hypnosis can be an effective way of recalling forgotten memories. Working on retrieving memories and managing psychological issues that may have contributed to amnesia are important aspects of any amnesia treatment. Preventing amnesia. A person can help reduce the risk of amnesia by: 1. Wearing protective headgear during activities that could result in a brain injury, such as cycling, skating, skiing, or playing contact sports. 2. Getting medical attention if there's a high fever, stiff neck, or severe headaches, which can be a sign of an infection affecting the brain. 3. Wearing a seatbelt while traveling in a motor vehicle, and never driving while under the influence of alcohol or drugs. 4. Having eyes checked annually to help prevent falls, especially if above the age of 65 years. 5. Exercising regularly to reduce the risk of a stroke. Comment below if you know further things about this disease that will helpful for us. At the end, it is requested to please subscribe our channel.